just a smile, our teeth and gums have a significant effect on our overall health and well-being. Dental and oral health, next time on Call with the Prairie Doc.
Good evening and welcome to On Call with the Prairie Doc. Dr. Holm is away at the annual meeting of the South Dakota State Internal Medicine Organization. My name is Mark Bubak of Dakota Allergy and Asthma in Sioux Falls, and I'll be filling Rick's rather large shoes. Tonight, we chew on the topic of dental and oral health and how important taking care of our teeth and gums is to our overall condition. So, of course, this week's Prairie Doc quiz question is about dental visits. So, the question is, the most common problem for which people go to the dentist is A, halitosis, B, dental cavities, C, periodontal disease, or D, gingivitis. Those of you who call in or email us with the correct answer will be placed in a drawing to receive a copy of Rick and Judith Peterson's book, A Picture of Health. Call or email your answer, and we'll announce the winner and give our answer later in the show. Now, we'll answer your questions about dental and oral care as they are called in or sent to us via Facebook or email. Call in your questions at 1-888-376-6225 or send us an email. Tonight, I'm joined by Erin Diers of Brookings Dental Clinic and Dr. Scott Terry of Midwest Periodontics and Implant Dentistry. Dr. Diers, tell us about your background.
I attended dental school at the University of Nebraska Medical Center in Lincoln, Nebraska, and graduated in 2006. And at that time, I practiced in Nebraska for about 6 years before joining Brookings Dental Clinic. And I'm actually working with one of my fellow classmates, Ann Johnson Harris, her husband Chris Harris, and then Jeff Johnson. So I've been in Brookings for about 3 years now.
Well, it's wonderful to have you here.
Thank you.
Dr. Terry, tell us about yourself.
I went to dental school at Northwestern University in Chicago and graduated in 1984. And then I did a residency in periodontics at the University of Iowa and have been in private practice ever since.
Well, neat. I guess what I have to start out with is a question for you, and what is periodontal disease?
Periodontal disease is basically an infection that is occurring under the gums. And the infection is caused by plaque that forms on your teeth. And it generally starts in places where maybe somebody doesn't brush or floss as well as they should. Because the plaque builds up in those areas that you miss, and then it will eventually get under the gums.
How do we know that we have that?
Well, a lot of people don't know they have it, unfortunately, but generally the first sign would be bleeding gums, maybe when you're brushing or flossing, and that's called gingivitis. And unfortunately, if the problem is not treated, that earlier form of gum disease called gingivitis can turn into what we call periodontitis, which is when the infection starts to destroy the bone around the teeth, basically, and then you start losing the support for the teeth. And if it gets bad enough, it can actually lead to tooth loss, and then the need for dental implants or dentures or something along that line.
So, as a general dentist, taking care of all comers, I guess you would say, I would think that your role would be quite important to try to get people to prevent problems. Do people come in for regular checkups? What are we trying to do to prevent problems?
Absolutely. You know, we see all ages of patients, and when they come in for a cleaning, at that time we take x-rays or radiographs to assess several things. We're not only checking for cavities, but we're looking for signs of periodontal disease, whether it be tartar or the hardened form of plaque, which is tartar, and sometimes that is visible on x-rays. And then you're also looking for bone loss, and those are both the tartar on the x-rays and in combination with the bone loss are things that you're checking for patients to help diagnose that, and make sure that either it's treated in the general dental office or in more moderate and severe cases we send them your way to the the periodontists and have them treat those more challenging cases.
But I do have to say that there's nothing that evokes quite as much anxiety in most people as going to the dentist or having root canals and all that, and yet it's something quite important. And what types of reassuring words can you guys give us so that
it's rarely ever as bad as you think it will be? How about that? I think everybody has a very low expectation when they walk in the door. So fortunately, with our modern techniques, anesthesia, even sedation if it's necessary, it's generally pretty easy to make patients comfortable during treatment. So it's
that's good to hear.
I think the biggest thing is a lot of people come in with stories from a past bad experience. For me, I feel like the younger patients haven't had those bad experiences, so a lot of times they love coming into the dentist office. They're very excited, but it's the older patients that have maybe had bad experiences in the past, and they bring those fears with them. So just listening to them, understanding their concerns and finding ways to manage those, whether it be just by reassuring words, techniques, and then there's sometimes medications that can help reduce anxiety, or like you mentioned, the sedation.
Sedation, sure.
Yeah.
Oh, that's great. Yet with the checkups and the dental X-rays, what kind of frequency are people needing to come in and have things done? What's recommended in 2015?
We, recommend that patients have their teeth cleaned every 6 months. And then, with x-rays, I think that may vary office to office as far as what the dentist chooses to do. Some offices will take x-rays every 6 months and some once a year. But I think that is very important because you can check things out clinically, but the x-rays really give you more insight to truly what's going on and allow you to detect, as I mentioned, the signs of periodontal disease, and you're also looking for decay in between the teeth that a lot of times you're not visually able to see. And so that's a really good way to detect that.
Well, fun. I guess as a general doc, are there diseases that relate to gum disease? There have been talk over the years that maybe heart disease or other things. And what's the actual status? Is there really a connection that's linked up, or that's bore out?
Yes, there's been a lot of research to try to determine the effect of periodontal disease on the rest of the body, and there are basically 4 conditions that we know that periodontal disease is a significant risk factor for, and that would be heart disease, stroke, diabetes, and rheumatoid arthritis. And we also suspect that it's a risk factor for Alzheimer's, bowel and pancreatic cancer, and conditions such as sleep apnea, obesity, even erectile dysfunction. So there are a lot of good reasons to get rid of these chronic infections like gum disease.
I would say. Is just routine preventative care going to do this, or once you've got I suppose once things kick in, we've got to take it up a notch?
Well, preventative care is probably the most important thing when it comes to your oral health, and especially when it comes to periodontal disease. Essentially, if people don't floss, they're going to get into trouble eventually, because most periodontal disease starts in between the teeth. And that's because most people don't floss, or if they do floss, they don't do it with the proper technique. So we see this all the time, because most people, unfortunately, aren't good about flossing, and that leads to trouble.
Well, I think we're going to have a little segment in a bit about how to actually floss. I think it sounds like that's
Well,
really
yeah,
important, so-
it'll be great. It'll be great.
It seems easy, but as he mentioned, there's definitely a technique or a proper way to do it. So.
Yeah, that's nice. Back in the old days, when people would have their dental cleanings and things, and they had heart valves or joints, we would give them antibiotics. Do we do that anymore, or is that not needed?
Oh, we still do it. It's really conflicting. I think a lot of it comes down to what the physician recommends, and it seems like a lot of the orthopedic surgeons are divided on how they recommend, antibiotics, and so we just follow the lead of the physician basically. But
Okay.
yes, we still prescribe it for antibiotic prophylaxis before certain procedures.
Okay. Yeah. Well, that's good to know. So basically, we just have to know what we have and if it's recommended or not, and tell our dentist.
There's guidelines that the American Heart Association recommends that what needs to be treated, like you said, an antibiotic prophylaxis. But then we always contact the physician to make sure that we're doing things correctly and we're on page with what they recommend for that particular patient.
Okay. I guess another question that I often had, my dentist always is looking inside the mouth and saying that they're looking for other diseases, like with the gum disease, are those kind of a window for a lot of other disorders?
Oh, sure. Autoimmune disorders, for sure. A lot of patients come in with red gums, and it's not due to periodontal disease per se, but it's due to an autoimmune disorder such as lichen planus.
Okay.
And we see this a lot. So for people who have sore gums when they eat or when they're brushing their teeth, a lot of times it's not just gingivitis or periodontal disease. A lot of it's due to an autoimmune problem.
Okay. Are there cancers associated with this?
Absolutely, and that's a good point that you bring up, that when a patient comes into the office, yes, we're checking their teeth, but we're also doing an oral cancer screening and checking, underneath the patient's tongue, down, in their cheeks and
Soft palate.
Yes, up on the roof of their mouth and the hard and soft palate, and checking for signs of oral cancer.
Are there some risk factors that can be modified for those patients?
Absolutely. Smoking, of course, is a risk factor, but chewing tobacco tends to be, one of the number one causes. And, there's other things, as even they say alcohol use can contribute to oral cancer. But, just knowing the signs and the symptoms, and then evaluating those areas and biopsying the suspicious lesion if need be.
Well, that's good to know. Let's see here.
And I guess another thing to point out too is, oral cancer doesn't have to occur in patients that smoke or use chewing tobacco. It's typically more prevalent in males, but sometimes you see it in patients that don't have a history of those habits.
Well, we've got some call-in questions here, and why don't we take one of these? A 21-year-old female having gum recession, what should she do?
Well, if she's 21, it's probably a situation where maybe a graft could be performed to take care of that, which we'll actually be showing on a video here later on in this broadcast. And we do so much grafting. It's a very common problem. We've done these on children as young as 6, 7 years old, and people as old as 90 probably for this problem. And it's quite predictable in this day and age to get good root coverage, if not complete root coverage, with grafting techniques. And we get a lot of practice at it because it is a very, very common problem.
Amazing. Well, I've got a second question here. A 60-year-old man from Sioux Falls, is mouthwash an advertising hype, and is it actually better than using water to gargle?
I would say it's absolutely
Well, yeah, we had a
better.
great little discussion about that
Yes.
before the broadcast here. When it comes to mouthwash, they all do something different. They all have different active ingredients. Some mouth rinses are basically breath fresheners,
Okay.
something like Scope, for example. And some mouth rinses have high fluoride concentration, so they're used to help prevent cavities. And then there's good old-fashioned Listerine antiseptic, which can be used to help actually for periodontal problems. So it really kind of depends upon what you want the mouthwash to do. So they all have different active ingredients. It's not hype most of the time, but of course you always have to,
You have to read,
you have to read the
labels.
label. You have to
You
read the
do.
label,
You do.
absolutely, yes,
Yep.
yes.
And there's a lot of products out there, and it can be very confusing. And I always, I get a lot of questions. What's the best toothpaste? What's the best mouthwash? And again, reading the label and then always looking for the ADA or the American Dental Association seal, I think is a good route too, because then you know that product meets the standards, and it's a good product. So.
That's good advice. It kind of sounds like the one you use might also be an important line, too.
Yeah.
All right. Another question. Let's see. A woman older than 60 from Hoven asks, what things do you need to do if you have a disease that causes dry mouth?
I think there's several factors that can contribute to dry mouth, and sometimes it is related to medications that you may be taking. And if that's the case, speaking with your dentist about that, speaking with your physician, and seeing if it's something that you can simply change your medication to one that doesn't have a side effect. But there's also products out there that can help as well. Of course, you're going to want to drink more water. There is, even chewing gum, and you're going to want to chew a sugar-free chewing gum, of course. But xylitol in the gum can actually help stimulate salivary production, which in dry mouth, that's...
How often do you have to use that?
That would be as needed. And then there's products out there. There's biotin comes in a spray or a rinse that can help those patients too. There's several things that can be done. But in those patients, I say for them it's especially important for them to have regular checkups, because with a dry mouth and that decreased salivary flow, you're more prone to problems dental-wise. And decay, so it's very important for those patients to be
Is it mainly
seen.
the cavities that are increased, or is the gum disease?
It can be both.
Absolutely, because if you don't have good saliva in the mouth, salivary flow, plaque builds up on the teeth much more easily. And if the plaque isn't removed, then it can lead to cavities, gum disease, any oral condition that's caused by the buildup of plaque.
All righty. I guess a follow-up idea is that patients asking, they've got Sjogren's syndrome with the real dry mouth, and they're seeing their dentist every 6 months. But what would you recommend for oral health and dry mouth? Like, so that those products that you just mentioned, I suppose.
Yeah. Yep.
Okay.
And it's really important that they have great oral hygiene and floss, because if you got dry mouth, I remember having patients in dental school and in residency that if you've got severe dry mouth and don't have really good oral hygiene, cavities just pop up everywhere, and it's just devastating from a dental disease
And it
standpoint.
is, and a lot of times, on those patients and older patients that do have gum recession, a lot of those cavities are forming on the root surface of the tooth, and that's a lot softer than the enamel on the coronal portion or the crown of the tooth. And when you develop those cavities on the root surface, they're going to progress a lot faster. And so just finding those and catching those early is huge for those patients, because it can be really devastating.
Sounds like we have to be pretty proactive with that group of patients.
You sure do, yeah.
Absolutely.
And even more frequent cleanings. You know, I know the standard rule is 2 cleanings a year, but if you've got dry mouth problems, you know, even 4 cleanings a year wouldn't be out of line by any means, just
Right.
to help keep the plaque off the teeth, and it could save them a world of problem from dental decay and periodontal disease standpoints.
Does the diet really make a difference for those people?
You know, I would say yes in some regards, because if they don't have the salivary flow, you know, if they don't have enough saliva in their mouth, that's what helps break down plaque. It neutralizes acids, and so if they're eating a high sugar diet, for example, it's going to be
foods.
it's going to be even more destructive in those patients.
Very good. Well, I think this is a good time. We often think of dental care as young children need braces or when elderly need dentures, but a variety of oral care issues may happen throughout our lives.
The procedure is called a connective tissue graft. Donor tissue was from the palate. After we elevate the flap on the teeth that we are doing the graft for, then we go to the palate, take tissue, what we call the connective tissue, from the palate. So in order to do this, I have to push the top layer of tissue back out of the way, so now the connective tissue is exposed. And then we remove the connective tissue and then suture that top flap back into place, which makes this a much easier procedure for the patients because they have less pain and bleeding following the procedure. You know, over the years, I can't think of how many thousands of grafts I have done, but it's, you know, it is probably one of our most common procedures that we do here. To the point where you can go to work probably the next day. I don't believe we've had hardly any patients that have missed the next day unless they just wanted to take an additional day off. Fortunately, they have to do minimal work to keep it clean because you use a prescription mouth rinse for basically 2 weeks. And the prescription mouth rinse is very good at preventing plaque from forming in the area. And in terms of eating, you just have to, well, I just say use common sense. You know, so foods that are softer, take small bites, and just remember to chew on the other side. Fortunately, ibuprofen takes care of the vast majority of the problems. My partner likes to use Aleve, so something along that line will take care of most of the pain. I do also prescribe a narcotic such as Vicodin as a backup just in case they need it. There's a lot of reasons why the gums recede. You know, probably the most common reason, or at least the most common reason that dental professionals will say is toothbrush abrasion. So you want to make sure that when you're brushing the gums that you're not scouring the gums, and definitely stay away from hard bristled toothbrushes. But we see a lot of this, you know, after orthodontic treatment, because many times the orthodontists have to move the teeth in a particular spot in order to get them to line up properly. So sometimes that's out of the front plate of the bone. So doing this after orthodontics, we have done a number of procedures after orthodontics, but there's a lot of reasons for it. So the only way I think a patient could prevent it from occurring is to be careful with their toothbrushing. But I will say this too, don't take that to mean don't brush the gums, because we see people who try to avoid the gums completely and then they end up with another problem, basically periodontal disease, because the plaque formation along the gum line. So you still got to brush the gums, but just be careful.
Well, thanks for that great
Well, thank you for
little
putting it on
procedure.
for me. Yeah.
Any follow-up of you know, anything extra we need to tell people?
As far as recession, what we can do about the recession many times comes down to why the recession occurred in the first place.
Oh.
If it was recession because of bone loss secondary to gum disease, we can't really cover the roots of those teeth back up. But if it's because of, let's say toothbrush abrasion, which is a common problem, even the movement of teeth with orthodontic treatment, there's just a lot of reasons why gum disease can actually happen. But if we have good bone around the teeth, I mean, if they haven't lost a lot of bone, and basically if they're not smokers or uncontrolled diabetics, we have an excellent chance for reclaiming the gum tissue over the exposed roots. And that's really good because exposed roots, they don't look good if they're, in a cosmetic area, but also exposed roots are more prone to cavity formation, especially with the question about dry mouth. I mean, oh my gosh, that's really bad in those cases. Or if people have just really sensitive teeth. If we can cover the roots back up in those cases, that's a major help for those patients.
Well, great. We'll get back to some questions here. 87-year-old woman from Sioux Falls asks, I have a tooth with a fractured root. What's the treatment for that?
This can kind of be a complex question. There's a lot of avenues to take with this, and I guess, it would depend on which tooth it is. Is it a molar or a tooth in the front, and how the tooth fractured? If it fractured vertically down the root, a lot of times the tooth needs to be extracted or removed.
Okay.
And then you need to look at options, and that can be quite complex too. Is the patient missing a single tooth? Then typically there tends to be 3 options. Well, I guess you could say 4 options. One would be doing nothing, but if it's somewhere cosmetic, I don't think many people go for that option. And then there is an option of something removable, a removable partial. But again, a lot of patients steer away from that option if possible because it is something that is removable and it tends to not be well tolerated, not very comfortable for the patient. And the other 2 options would be a bridge or and that's where you have a missing tooth and you place crowns on the 2 teeth adjacent to that space, and that would hold a crown in the middle. And cosmetically, those look pretty decent. But there are some downsides to that as well. And I tell patients this all the time that, depending on the condition of the adjacent teeth, are they, I could draw
a picture. Show them how that really works.
Yeah, depending on the condition of the adjacent teeth, they may not be suitable to support a bridge. And if you've never had any fillings or restorations done on those teeth, do you want to put crowns on them? And so for myself personally, or what I tell patients, probably the best option if it's a good location for the patient is to do a dental implant.
Okay.
And the reason I say that, there's several advantages. You're not having to disrupt the adjacent teeth. It's an independent tooth replacement option, and because it is man-made, it does not decay. It does not get cavities, which is another wonderful option for the
Probably
right
still
patient.
have to floss it though.
You have to take good care of it.
Absolutely do.
Because
Yes.
unfortunately, they are susceptible to the same gum diseases that your natural teeth are, so you've got to take
They
good
are.
care of them. And I will also say too, if it's a molar that has more than 1 root, depending upon where the fracture is, there is a surgical option to remove the bad root, the one that's cracked, and save the other roots, which would then give the tooth enough support.
Yeah, and those can function quite nicely.
Oh yeah, they function just great if they take good care of it afterwards.
Yeah.
It's nice that we have these great options for people.
There is
Yeah,
a lot of
it's not
options.
There are
right?
options.
It's
There
not
are
just
kind
getting
of-
dentures anymore.
Yeah.
It's kind of complex.
Yeah.
Depending, there's so many variables that come into that, and like I said, depending on the tooth, the location, the bone there to support an implant. There's so many factors that come into play. So I guess, for that gal in Sioux Falls, just seeing her dentist
Okay.
and evaluating that situation would be the best.
Well, we keep coming back to flossing, and I think it would be really nice for us to kind of have a look at that. We've got a little segment, and we could talk about it here.
Oh, well, as we look at that, I'm not real enamored with the technique of that particular video. What they're showing in that video is
What's wrong?
well, they are sawing back and forth and not so much scraping up and down the side of the tooth. So they're kind of doing the opposite of what should actually be done.
So we want-
to go up and
Okay.
down. Yes, we want to
So-
go up and down. right.
Okay. Well, I think we might have a better technique that we could show people. How is this person
Oh,
doing?
now that's good. Look at that.
Look at the plaque flying
Yeah,
off the
wow, look at the
boards.
plaque fly off. It's just that easy, just that easy.
And how often do we need to do this flossing?
Once a day.
Okay, once a day?
Every day.
Every day. You
Once-
can't take holidays off.
Okay, every day that ends with a
Weekends
Y.
are not an excuse
Yes.
to not floss. You,
Yeah.
you got to do it every day. And this is really especially true for people that have been found to be susceptible to periodontal problems. Because we know they're susceptible, not everybody is, but they are, and they have to take the flossing quite seriously after treatment.
They have to step up their oral
They
hygiene.
absolutely do, because if they don't, the problem unfortunately comes back again.
Now, does it make a difference if it's flavored floss
It makes
or
no
if it's
difference.
waxed or?
And there's actually, I'm glad you mentioned that, there's lots of flossing aids.
Hmm.
And some of them, you know, I have patients say, I can't use regular dental floss. I can't get that in the, you know, to my back molars.
Okay.
That does not work for me. So there is different flossing aids out there and available at any store, basically, that can help patients reach those areas.
And so you just have to get a product that you like.
Or one that's
and-
designed right.
Yeah, there's some better than others.
There's
but
some that are much better
How
than
about,
others.
how about the little hook things, the little roundy guys? Are they?
The little, what are they called? Floss picks or something like that.
Yeah, there's-
They aren't designed really well for flossing with the proper motion
Right. They
in the
look
back
like-
areas.
They almost look like a saw.
Yeah, and
Yeah.
that's about what they work like too.
So up and down. So up and down.
you got to
is
be able to go
Yeah.
up and down. You have to use the proper motion regardless of the floss aid that you have.
Okay. Well, I'm glad that we went through that.
I
because
know, it's a
I don't
big-
think
it's a big
most of
topic.
us are doing that right.
Probably not.
Yeah, it's embarrassing. I have another question here. Let's move on to a 63-year-old man from Sioux Falls, hoping that we'd mention something about the importance of people with dentures having the fit being checked and the health of their mouth. That's because his mother had dentures early, never had them checked. They didn't fit and caused a lot of inflammation. And unfortunately, there was some cancer type of changes that had happened.
And that's a great question. A lot of patients will come in and they say, I've had my dentures for over 20 years, and they may have never been seen by a dentist. And yes, the fit of the dentures is very important to monitor that. But in this case, you know, the oral cancer screening would also be something that, you know, would be good to have those patients evaluated. And there are other conditions that can occur under dentures. Years ago, patients were instructed to sleep with their dentures in overnight. Now we recommend that patients do leave them out overnight and clean them. And that can prevent some of the fungal infections and things of that nature underneath dentures. But that oral cancer screening, I can't stress that enough. It's so important.
So it may not have been the dentures, it may have just
Well,
been...
I'm sorry for cutting in.
that's-
What a lot of people don't realize is that once you lose your teeth, you lose the bone in your jaws. And that's the reason why dentures don't fit after a while, because once the teeth are gone, the body senses that the jawbone is not necessary, and then the bone is resorbed, and that's when the problem with the fit. So for a lot of people who would come into, say, my office and are asking whether it's worth holding onto the teeth or should they have them removed and have a denture made, it's you know, a lot of people will say, well, the dentures will fit well in the very beginning, but give them 5-10 years, and then suddenly they're becoming loose because they've lost a large amount of the bone under the dentures.
Is there anything that people can do to prevent that loss when they get dentures?
Dental implants.
Don't get the dentures, get the implants.
Well,
Is that the
well,
idea?
the dental implants help to support the denture should you need a denture, or you can even put crowns on implants. You could essentially restore the entire mouth with implants and put crowns on the implants, and it's like growing another set of teeth. I mean, it functions like teeth, looks like teeth. They're amazing. I mean, it's great, but it's, you know,
There are a lot of options out there for patients, which is nice because, as you mentioned, that bone does resorb and pull back over time. And once you lose that, the dentures basically have nothing to hang on to. They lack retention. And so the implants are a great
Absolutely.
avenue, especially lower dentures. You know, patients tell me all the time, my top denture's fine. And part of the reason is that denture rests on the roof of their mouth, and so they get a lot of retention from that. And they'll say, my lower denture is horrible. I cannot keep that in place. And a lot of that is we have our tongue, and that's a very powerful muscle. And every time we speak and every time we chew, that pushes and acts to dislodge the denture. So implants
Implants
especially.
are great for holding dentures in, and if a patient is in for a consultation regarding periodontal disease, we stress a lot the importance of holding onto your bottom teeth. Even if you have an upper denture, you don't want to lose your bottom teeth, because the lower full denture is a totally
struggle.
different beast. I mean, it really
It
is.
is.
It's just hard to keep it in, and your quality of life goes way down in many
It
cases.
does.
So this isn't quite like it was when like growing up seeing grandma with the dentures. There are a lot of options. It's so nice for
Dental
people.
implants have really changed the game completely.
They have.
Yes.
Yep.
Okay, next question. 83-year-old from Sioux Falls had 2 root canals and was left with a space between the 2 molars. Is it better to put a cap with no bridge or put the caps with a bridge?
So, well, this would, in my opinion, you know, anytime you've had a root canal done, you know, you're not only removing the nerve, but the blood supply to that tooth. That tooth is going to be a little more brittle. And they do recommend placing, you know, crowns on those teeth. And it's kind of the standard of care that's going to help hold those teeth together. But in this situation, he's asking if those 2 teeth should support a bridge. And I don't know if I would go that route. And again, it depends where it is in the mouth. But if it's in the back, he might be better off doing crowns on those 2 teeth and replacing the missing tooth with an implant and keeping those all independent from one another.
Okay, well, kind of blends right into 63-year-old man from T, possibility of a partial. Could you give pros and cons as well as some general info?
You know, it's a good way to replace multiple missing teeth for a patient, but there, you know, are downsides to that as well. You know, when you have a partial made, the partial is going to rest and clasp around your other teeth. So I tell every patient that is going into a partial that you have to step up your oral hygiene much more than it ever has been before, because that partial is going to rest on those teeth, and if you eat a meal and food gets underneath that partial,
Wedges in.
now you have that partial holding plaque on top of the other teeth, and so it can lead to other problems.
Dental implants, once again, a lot of these discussions go back to dental implants, it seems like, but if you can avoid a partial denture in this day and age with dental implants, you're probably, wouldn't you say they're probably doing better than they would if they had a partial?
Oh, absolutely.
Yeah. You know, dental implants, and they don't have a prosthesis that comes in and out of the mouth, and food doesn't get stuck underneath the framework and stuff like that. So dental implants, if you can do it, would be a nice way to try to avoid partial dentures if at all possible.
With most of the patients in my practice, cost and coverage issues are always something.
Of course.
What kind of relative
Yeah.
cost types are the implants the most expensive, or maybe in the long run they're not? Can you kind of give an idea?
Obviously there is different circumstances, and implants, yes, they do come, they are more expensive, but I always tell patients, you know, you have to put this treatment into perspective, because if you place a bridge and you don't floss underneath of that, and that fails, now you, instead of having lost 1 tooth, you suddenly have lost 2 or potentially 3 teeth, where if you maybe had done the implant up front, you could have avoided that and the additional cost down the road. So when I'm treatment planning with patients, I try to think long term, and maybe a little more up front might save them tremendously down the road.
A lot of it comes down to the circumstances as well. Looking at the surgical placement of an implant, the ability to place an implant many times comes down to the amount of bone in the area, because you have to have the adequate bone to support the implant. There are ways to create the bone if it's not there, but once again, that adds time and expense to the treatment plan as well. So, the cost of an implant, it's kind of relative, I guess. Some can be, pretty easy, generally speaking. But if you need multiple grafting procedures to get it the adequate bone, then suddenly becomes even a little more of a pricey type of restoration.
Well, it's nice to put some of those perspectives. It is upfront plus long term. I have an interesting question, I think, here. Even as an allergist, I get asked this type of thing. An 81-year-old from Marion says, I'm hearing that a lot of countries in Europe are outlawing amalgam fillings that contain mercury. Is there a similar movement here? I guess, what's the status of all these things that we hear?
This is this debate's been going on for quite a while. And the American Dental Association still maintains that it's safe. They've done lots of research. I have amalgam or silver fillings in my mouth,
So
and
do I.
I always tell patients, I say, these have been out over 100 years, and there's a lot of medications that we take that don't have near the history, and so we do some silver fillings. I do a lot of tooth-colored or fillings or composite resins.
Okay.
But unless there's something wrong, I don't think patients should go ahead and just replace all those silver fillings, because when you do that, you're essentially traumatizing that tooth unnecessarily. So if they're intact and they're functioning fine, I think that they're safe at this point. So
all the stories of the aches and pains and all the other things really haven't panned out quite.
No.
Really haven't.
That's
No,
so good
and
to
it's
hear.
been-
Yeah, it's great to hear.
yeah, I mean they've studied it extensively.
Yeah, it's been a lot of years.
Yes,
Yeah.
yeah.
Okay. All righty. 72-year-old woman from Black Hawk asks, wonders why toothpaste is advertised as having baking powder for whitening in it when baking powder breaks down your enamel. Is that true?
I don't know that the
Not sure that-
baking powder whitens per se.
The baking powder, if they said it is for whitening, it's because it's an abrasive, basically. But whether it breaks down enamel or not, I don't think I've ever heard that myself.
I suppose if you used it very frequently, a lot of the whitening toothpastes they're a little more abrasive, and they're
that's how they
going
clean,
to polish off the extrinsic stain or the surface stains of the teeth, and that's how you get some of the whitening that occurs. So I suppose if you used it excessively, yes, I guess it could break down your enamel.
Are there some chemicals that are being used also to make the teeth whiter?
There is, and if there are the toothpaste that advertise whitening, they're a little more abrasive, and then they do put some chemicals in those, and then there's also different options for, there's over-the-counter whitening options, there's in-office, from bleaching trays to the lights that offices have, and it just varies from practice to practice, but absolutely, hydrogen peroxide, there's different formulations and concentrations of the materials used depending on the product.
These products work overall?
Overall, and again, I would encourage, if any whitening product, make sure that it's ADA approved and you're doing a little research before you're using it, for sure.
Okay. Well, that's good. So let's see. Next question is wondering if receding gums is genetic.
Probably not in the truest sense of the term genetic, but in terms of the genetics and the shape of their jaw versus where their teeth have erupted, and if they don't erupt in the quote unquote right spot, that can lead to recession. And we do see cases where a mother had receding gums and the daughter has receding gums in the exact same spot that the mother did. But it's really, I'm not sure that we can call that genetic.
Okay. Oops. I just did the thing here. All right, I was also wondering if it's more the genetics of how much mom and dad brush their teeth, it might make more of a difference than anything else. Or floss.
It's, I mean, a lot of it comes down to home care and
it comes down
habits
to
and diet.
The kids see what mom and dad do and follow suit.
All right, 63-year-old man from Sioux Falls, hoping that we'd mention something about the importance of people with, let's see, I just skipped the wrong one here. I'm sorry, what's our next question? 63-year-old woman from Sioux Falls for the last few years has had little red raised dots on each side of the mouth by the upper teeth. They come and go. Been to several dentists and they can't say what they are, and was sent to an ENT, and they're still not sure what they are. Any ideas with that description?
There's a lot of diseases in the mouth that have little red
bumps.
Yeah, exactly.
Yeah,
So,
that's a tough one.
and that's a tough one to answer in this type of forum. But take a biopsy. We do a lot of biopsies, and I'm not sure why somebody hasn't taken it to that step yet. But a biopsy would help to explain what it is, why it is, and maybe how to treat it.
Okay. So, what do you guys think the biggest change in dentistry really has been?
Probably depends on which branch of dentistry we're talking about, but
it's like in your field.
Okay, for me, the use of lasers
Okay.
for the surgical treatment of moderate to advanced periodontal disease. Our practice has been doing it for about 2 years now, and it's just phenomenal, the results that we have been getting with this technology. And what's really nice is that it's minimally invasive compared to the more traditional forms of periodontal surgery. And because it's minimally invasive, that's easier on the patients, less discomfort afterwards. Almost everybody goes back to work the next day. Yeah, it's a big one.
How about with the general dentistry?
We keep talking about implants, but I think that's been huge. And I think also just the overall opinion of dentistry as a whole. I think, you've seen, we talked earlier about the shift of, patients fearing the dentist. And I think that's, just the improving the way procedures are done and the way patients experience the dental office has been a huge improvement for oral health in general.
To let people get in and get these things done.
Yeah.
Yeah, absolutely.
All right. Then, let's see. Another question, maybe? No? Okay. It's time for the quiz answer. All right. And now for the winner of tonight's Prairie Doc quiz question. The most common problem for which people visit the dentist is A, halitosis, dental cavities was B, C is periodontal disease, and D was gingivitis. All righty. The most common problem for which people go to the dentist is B, dental cavities. And they're actually the biggest reason. They're also the second most common health disorder overall for us. The first most common is the common cold. Amazing.
Yes.
Yeah. It is Jean Linton from Sioux Falls who correctly answered our question. Thank you, Jean, for your answer. Your new copy of A Picture of Health by Dr. Holm and Judith Peterson will be in the mail to you very soon. We'll be right back after this.
All around town, from stores to playgrounds, babies are on the move. And there are diseases that are on the move too. And some of these spread easily. To best protect him from 14 serious diseases by the time he turns 2 years old, vaccinate him according to the recommended schedule. So he can go on about his business and you can have peace of mind. For more reasons to vaccinate, talk to your child's doctor or go to cdc.gov/vaccines.
Halitosis is the medical word that stands for bad breath, coming from the Latin halitus, meaning exhale vapor. In college, I heard it put this way: the Polish army must have marched through my mouth last night. Not only is it socially offensive, a foul odor coming from between the lips can also reflect a serious underlying dental or medical problem. Halitosis is the third most common reason people seek out dental care, but studies find different answers, reporting that 10 to 75% of those who worry they have bad breath actually don't have it. When patients really do exude bad odor, probably the most significant cause for this malodorous condition is dry mouth and coated tongue, often resulting from medicines like decongestants for stuffy nose or pills for urinary incontinence and a resulting growth of bacteria. Dry mouth can also be due to mouth breathing or advanced aging or to an immune disease which affects the salivary glands. No matter the cause, running low on saliva not only will turn the breath foul, but the teeth will then too easily become infected and fall out. Periodontal disease with plaque and gingivitis causes bacterial infection below the gum line and can certainly cause the odor of rotting. But so can a bacterial infection in sinuses, lung, pharynx, esophagus, or stomach. It almost goes without saying that smoking or smokeless tobacco also causes doggy breath. Of course, garlic and onion give their odor after absorption into the bloodstream, which is then carried to the lungs and then transferred to the breath. Treating halitosis starts by avoiding tobacco habits, avoiding mouth-drying medicines when possible, and stimulating saliva by sucking on sugar-free cough or lemon drops or sugar-free gum. Some experts advise that brushing the tongue will remove the coat and will go a long way to improve one's breath. Certainly, prevention of periodontal disease with flossing, water picking, or special tooth picking is important to reduce the odor and tooth decay. Mouthwash and mints will only cover up garlic and onion breath until time resolves the odor by breaking the chemical down that is being carried in the bloodstream. You can escape the plotting Polish army. Remember that bad breath makes a compelling case for good brushing, good flossing, and when there is that hateful halitosis, for seeking dental or medical care.
First, a great big thank you to our guests, Dr. Erin Diers of Brookings Dental Clinic and Dr. Scott Terry of Midwest Periodontics and Implant Dentistry. Their knowledge and insight into our topic was invaluable. Second, thank you all at home for joining us tonight. Believe it or not, this is really a big thing for a doctor, much like getting a chance to host Saturday Night Live. For more about tonight's topic or any of our previous programs, visit our website. From all of us here at On Call with the Prairie Doc, until next time, remember, your health starts with you.
Some diseases move from an animal host to humans, like bird flu or Ebola. We are part of a huge interconnected biosphere. The human-animal disease connection, next time on Call with the Prairie Doc.
Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota.
Additional funding is provided by
Aberdeen Asthma and Allergy,
Brookings Health System,
Dakota Allergy and Asthma,
Dakota Care,
Dakota Dermatology,
the Orthopedic Institute,
Physicians Care Sanford Clinic Community Service Committee.
and Swiftel Communications.
Closed captioning for On Call with the Prairie Doc is provided by the generous support of
Avera
Brookings Health System,
and Fishback Financial Corporation.
Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you. We've got a 79-year-old woman. What is the cost of having an implant put in? Is there a kind of a general,
Let's say for a general, I'll just give
Just
probably
ballpark.
$4,000, $4,500 for putting the implant in and restoring it. I'm thinking if you're thinking around $4,000, $4,500, that's about what one implant costs.
Okay, and then it's different depending on what other diseases
Exactly.
and
If you need
conditions are
to do
happening.
ridge augmentations and whatnot to get enough bone to place an implant, then of course the cost goes up, as well as the time to get the final product.
Okay. 72-year-old woman from Plankington. Oops, I just moved me around. What do the doctors think of electric toothbrushes and water picks?
Well, they'd work well if you use them right. I mean, everything comes down to technique. You could have the greatest product ever designed and the greatest toothpaste. If you don't use them right, they don't work.
Okay.
So, but generally speaking, I don't like the $10 spin brushes very much.
I was going to say,
And,
make sure you're getting a quality.
Yeah, get a quality. Like
electric
I don't
toothbrush.
know if we can say brand names, but Sonicare, Braun Oral-B, they're rechargeable. I mean, you're going to spend more than $100 for those, but they do work well.
And a lot of them have timers on them too, which is nice because sometimes
How many
patients don't.
minutes are you supposed to
2
brush?
minutes, and sometimes you don't realize. It seems a lot longer when you're actually timing it.
But I tell people, don't follow the timer. Do it as long as you can do it.
Well, exactly. But they need to at least
At least do it
make
2
the,
minutes.
At
Yeah,
least
2
make the
minutes.
timer.
Exactly.
Okay.
Yeah,
Very
you can brush
good.
longer if you want
Alrighty.
to.
41-year-old from Watertown. I had my braces removed after 2 years. Some of my teeth became real sensitive, like never before. I bought a whitening tray kit from the dentist after getting cleaned. After cleaning, it was real irritating when I did it. I think it might wait a bit before using it again. questions, things like Sensodyne toothpaste is something the person's being used or is using. Any suggestions as to, is there more that maybe needs to be done?
Probably, let me see, the concentration of the hydrogen peroxide.
Yeah.
I mean, if you're buying if you're getting a whitener, not, of course we don't do whitening in our office, but if you have a whitener that a lot of times you'll buy from a dentist, and these have a very high concentration of hydrogen peroxide, and yeah, they can make your teeth pretty sensitive. I mean, they work, but
They
yeah,
do.
yeah, but
Yeah.
the sensitivity following that can be quite uncomfortable.
Okay. Another question is, when should you get your wisdom teeth out?
You know, that's, well, and that varies patient to patient, but a lot of times it's around 17, 18. But what we look for is, you know, how the teeth are erupting. Are they coming in straight? Are they angled a certain direction? Are they going to affect the molars in front of it? And a good time to have them removed is when the wisdom tooth is about 2/3 of the way developed. And the nice thing is too, you know, you want to have them out before the bone gets really dense around those wisdom teeth as well. It's just a lot easier to have them removed at that time.
Does everybody have to have them out?
Not everyone. I
Not
mean,
everybody.
you know, and that varies from dentist to dentist on their opinion on that.
Yeah.
But from a hygiene standpoint,
Oh, from a periodontal disease standpoint.
I have a feeling
Oh my gosh,
of
yeah.
what I know what his opinion is,
Well,
because they're challenging to clean.
Now, I'm a conservative guy when it comes to recommending wisdom tooth removal. I'm like, well, if they can take good care of them, there's no disease, no cavities, anything like that, no gum disease, I'll keep them. There's no reason to get rid of them at that point, but they are way in the back of the mouth, and they tend to be really difficult to clean. And we see a lot of gum disease problems around retained wisdom teeth. And then at that point, then they should go.
Okay.
Right.
Oh, great.
So it's the alignment of the teeth and the
Yeah,
oral
alignment of
hygiene
teeth.
that goes
There's
with
a lot,
it.
once again, like everything, there's a lot of clinical factors that play into the decision.
There is. Yep.
Okay. Well, thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them. Remember, your health starts with you.